Hello, my name is Laura and I'm a physiotherapist at When Kids Place. This webinar will cover pool therapy and activities that you can do with your child in the pool. What is pool therapy? Pool therapy is rehabilitation in the water to help increase strength, range of motion, balance, walking ability, and to maximize potential function. Benefits: increase physical fitness and endurance, decrease muscle tone and spasticity, increase muscle strength, increase joint range of motion, improve balance and coordination, improve walking, increase circulation. Benefits continued: social activity, increase comfort in the water, promote relaxation, increase motivation and positive attitude. The child is often able to perform an activity that they are unable to do on land. The water permits easy movement and positioning for treatment by the caregiver. There are contraindications, however, to using pool therapy. These would include open wounds, extreme fear of water, contagious rash or skin infection, external fixators, urinary infections, allergies to pool chemicals, fever over 100 degrees Fahrenheit, respiratory diseases with severe compromise of vital capacity, the ability of your lungs to hold air, uncontrolled blood pressure, too high or too low, uncontrolled seizures, and tracheotomy. Precautions. The following require further consideration and/or consultation with a medical professional: angina, feeding tubes, pregnancy, multiple sclerosis, absent cough reflex. Equipment options: flotation devices, including life jackets, pool noodles, flutter boards, floating mats, waist belts, neck supports. Resistance devices, including weights, buoyant objects, webbed gloves, and flippers. Here are some pictures of equipment that you could use in the pool. Principles of stretching and handling. Warm water induces relaxation. Pain from muscle spasm can be relieved by water, permitting a better stretch. The child is unencumbered by clothing, so they move more easily and you can see and feel the stretch. As many children enjoy the water, their positive mood may lead to deeper relaxation. Stretching and handling continued. Stretching techniques done on land are usually easily modified to be done in the water. Use a wide, comfortable grip. Principles of stretching. Hold the stretch for at least 30 to 45 seconds. Stretches may be slightly uncomfortable, but should never be painful. Apply a gradual pressure, never force a movement. Now on to techniques. Seaweeding. Holding the child about the lower legs or under the arms, gently tow them through the water. Weave their body side to side or up and down as you walk through the water. They should move through the water in a fluid way, like a piece of seaweed. In this first example, the child is being held at their arms. In this example, the child is being held closer to the hips. Rhythmic leg movements. Position yourself at the child's feet. Hold onto their lower legs. Bend one knee up to their chest. Slowly bring it out straight again while bending the opposite knee. Continue the pattern slowly. Note, there is a pool noodle under the child's head to help support them in the water. Seated rocking. Place the child sitting sideways across your lap while you lean against the side of the pool or sit on a step. Using your knees in an alternating way, cause the child to rock slowly forward and back. Encourage them to try to remain upright as this occurs. Also challenge the child's balance by displacing them in different directions while they sit on your lap facing outwards. Lifting body parts out of the water. Assist the child to float on their back. Provide them with very little support while instructing them to lift parts of their body out of the water. Begin with small movements, i.e., lift a finger. Progress to a larger movement, i.e., lift a leg. See if they can lift more than one body part at a time. The object is for them to maintain their floating position while doing this. In the photo, you can see the child initially lifts their knee out of the water, and in the second photo, they're lifting their whole leg. Chest wall stretch. Have the child floating on their back with the caregiver standing at their side. Without allowing their body to twist, stretch them around you so that their body curves into a C shape. Place your hands on their hip and one on the upper trunk on the same side to do this. Reaching. Have the child stand on the bottom of the pool with their back to you. Hold onto their waist lightly and have them reach forward as far as they can without falling. Return to the center and try again. Try reaching for a poo noodle. Standing with turbulence. Stand the child on the bottom of the pool, beginning in chest-deep water. Give them as little assistance as possible to remain upright. Using an object, or your hands and feet, churn the water around the child, asking them to maintain their balance. Try walking quickly around the child while they attempt to stay balanced. Make the task more challenging by decreasing the depth of the water. Pushing a floating object under the water. Use a variety of floating objects and practice pushing them underneath the surface of the water with various body parts. Control the rate at which they rise back up to the surface. Push-offs. Have the child float on their back and have a buoyant object supporting their neck. Have them bend their knees and place their feet against the wall. Have them push off the wall as hard as they can and then glide until they come to a stop. Experiment with different arm positions, such as hands together, hands apart, arms at the side. If the child is comfortable on their stomach, have them do the same activity, only on their stomach. They could also try pushing off with their arms. Sitting on a pool noodle. Try sitting on a pool noodle and not falling off. Sitting on a pool noodle, you can use your arms to move forwards and backwards. You can also use your legs to try to move as well. Flutterboard. Have the child hold the flutterboard in front while they are working on kicking. Jumping into the pool. Practice jumping into the pool. You can provide support at first to help the child feel comfortable. You can try placing a poo noodle in the water and try and have the child jump farther than the poo noodle. Gradually increase the distance of the poo noodle so that the jump becomes more challenging. You can practice cannonballs and pencil jumps, legs straight up and down. Jumping and hopping. Practice jumping or hopping across the pool. Surfing. Have the child try to stand on the poo noodle without falling over. You can also try this with a flutterboard. Pulling caregiver through the water. Float on your back and have the child pull you through the water. Spread yourself out or make yourself more streamlined to make the task harder or easier. Reminders. Water temperature is important. Cold water increases muscle tone. Warm water relaxes tone. Dry the child thoroughly after swimming. If they get a chill, you could reverse the effects of the session. Watch the child closely for any abnormal physical signs such as distress, fatigue, or overexertion. Take them out of the water immediately if you notice such changes. Watch for signs of dehydration. Replenish fluids frequently if spending time in the water. When handling the child, use relaxed hands. Thank you. If you have any further questions, please contact One Kids Place.